Hello, good evening, good afternoon, or good morning to you, wherever you're watching from in the world. Thank you for joining us. We appreciate it. If you are joining us again from last week, then welcome back and thank you for tuning in. If you're joining us for the first time, then welcome along and thank you for giving up your time on a Sunday to be here with us. Today's episode is a particularly personal one. As it's a topic which we feel is not discussed openly enough, and in fact often misunderstood when it comes to the conversation around diabetes and how it has a knock-on effect on many other aspects of our lives. And today's aspect is sexual health and relationships. We've had a lot of good feedback from the content we put up so far, and some people have been really curious to know different things and different ways in which this condition can affect one's sexual health. And so I've got a great panel here with me this evening to discuss this very topic, guys with a lot of varied and interesting experiences. And we've got an OBGYN with us to give us that expert medical opinion and insight into how this condition can affect various aspects of sexual health and relationships. So without further ado, I'm going to bring the guys on. Please, if you have any questions or comments, let us know in the chat when we can bring them up on screen and hopefully make it a very open and very powerful and relatable discussion. So we're putting our balls on the line here. We're going balls out honesty, if you like, and we look forward to getting vulnerable, getting open, and really driving more understanding and awareness around this topic, which we feel isn't that commonly discussed. So meet the team. My name Earl, Sally, and Dr. Christopher. Thank you all for joining me, guys. Really appreciate it. Thank you for giving up your time.
Thanks so much, Jacob. And thanks to everyone, everyone tuning in. We're so happy that you could join us. We were a bit concerned because the president is addressing the country at 8. But we trust that those who are tuned in, will actually take something from this webinar. And, it's always just our sort of end goal to normalize issues around men's health, and particularly for this webinar, men's sexual health. So just a quick introduction for the panel. Jacob is our host. And then we've also got Brennan. He's joining us for the first time tonight. Brennan is a diabetic from Johannesburg. He's a single father, actively dating, and it would be so interesting to have his insight on, how diabetes affects his dating life. And then we also joined again, fortunate enough to be joined again by Sally Hendricks, who was on our panel last week, you may recall. And then last week we had a disclaimer that we had no sort of medical insight to anything, and everything that we were chatting about was from our own personal experiences. But we are fortunate tonight to have Dr. Christopher Alkers on our panel. So thank you so much, Dr. Christopher, for joining us. Dr. Christopher is a qualified gynecologist who studied at the University of Stellenbosch from the year 2000 to 2006, and then did his internship in the Eastern Cape from 2007 until 2010. And then he started specializing when he joined Tygerberg. Well, he first joined Tygerberg in 2011 and started specializing from 2014 in OBGYN. So we've got an interesting balance here where you can address men's health issues, and also we can address women's health issues as well, being a qualified gynecologist. So please do not hold back on the comments. Hopefully some men will also ask some questions in the comments tonight. So I think before we kick off with things, I think, Jacob, you want to share a diagnosis story just in 30 seconds?
Yeah, for sure. So this, in fact, this is a particularly personal topic for me because this is where my entire diabetes story originates. So when I was diagnosed, I didn't have many of the common symptoms that you usually associate with a pre-diagnosis. I wasn't losing weight. I wasn't frequently thirsty. I wasn't, urinating particularly frequently. I had none of those, common symptoms. But I did develop thrush. And for those of you who don't know, that's a yeast infection. It usually manifests itself in the throat, or in my case, on the genitals. And so this came out of nowhere. I mean, I guess there's a lot of diabetes kind of diagnosis stories do. But like I said, no other symptoms until one day out of nowhere, I just noticed, that something wasn't right down there at all. Without putting too fine or graphic a point on it, I had a worrying infection, shall we say. And I was a 20-year-old student at university. And, so I naturally thought it was something else. The only thing was, at the time, I'd gone through actually a breakup a few months prior to that, and I hadn't been with anyone else since. So it would have been, let's say, highly unlikely for it to have been an STI, but I had no idea what it could have been otherwise. And so then I went down to the sexual health clinic in the city, and I got swabbed, and I got my blood drawn because they test for like HIV and so on. So I got my blood drawn, I got swabbed down there, I peed in a pot, did all that stuff, and the results came back, and they said, no, you're fine. It's not chlamydia. It's not anything to be worried about, except your blood sugars are outrageously high, and that is confirmed that's thrush, and your sugars are ridiculously high. We're going to refer you to a specialist. And I just thought, nah, no way, can't be. So I just pulled my trousers up and marched out of there and didn't give it a second thought, And then a week later, I got a call from the local diabetes clinic they'd referred me to and said, you've got to drop everything and come to us right now. And then that afternoon, I was a type 1 diabetic, if you like. I went and got my insulin, my needles, my testing kit, all of it. And out of nowhere, and up to that point, I had no idea really what diabetes was. I'd never considered it, and even when I started looking at what the thrush could have been, it didn't quite click to me that it could have been a symptom of that. I didn't know how high my sugars were at all. I had no other symptoms or sensation, and so yeah. So anyway, so a lot of it's just one of those kind of really left field ways to be diagnosed, I feel. It's not uncommon, but it's not one of the ones you usually hear about. And so this is why this is a really personal issue for me, is because this is where my whole diabetes story stems from. And I think an awareness for those, for those who are watching who aren't diabetic or maybe know someone who might be or something, it's just bringing that awareness to the fact that this is one of the symptoms. This is one of the results of having high blood sugar, is developing these kinds of infections, because the sugar in the yeast feeds off the sugar in your urine, so it's just something to be aware of in that respect. So yeah, so that's why this is a particularly personal topic for me. And of course, over the years and the relationships that I've had, diabetes has sort of crept in different ways, not all of them kind of particularly positive in some aspects. So it's definitely, in the 10 years since diagnosis and evolving from a university student who was just drinking and smoking all the time to now taking a bit greater interest in awareness of my health. It's kind of interesting how that journey has evolved as well. So yeah, that's the diagnosis story.
That's quite unique, because I think most of us can agree that we ended up in hospital in DKA, and that's how we were diagnosed. So that is quite a unique story, actually. I think we need to move on to Dr. Christopher right now. So, Dr. Christopher, how are you this evening?
No, I'm well, thank you. Thanks for having me tonight, Earl. It's a pleasure being here. I always enjoy talking to just people in general. It's great to be in a panel of men, and I'm sure we'll have some interesting topics and discussions coming up.
Thanks so much. And I think we're actually just going to dive straight in, because I'm sure everyone's just burning to hear, where we actually going to go with this. And, we actually have no plan where it's going to go, but we know the outcome that we would like. And that's just to normalize everything. And I think, I think that the best way to maybe just tackle it first and foremost is maybe if you could just describe some of the various sexual health problems, that men with diabetes can experience.
Yes, I think that in general it's a spectrum of problems, and I think often we focus a lot on what are the physical attributes, how diabetes impacts people in general. I don't just think that's a problem of men, but specifically with men, I mean, there's the obvious problem that we're speaking about tonight is erectile dysfunction. People having low libido, low sex drive in total. And then the other thing is obviously that if you have a low sex drive, and that is established itself, that leads to further problems psychologically, like to your confidence as a man to obviously perform in the moment. And I think for a man, even without diabetes, that does become a problem, even if you are otherwise well. So I think that is the main thing. And then there are other comorbid conditions, obviously, which leads to you having exercise intolerance, and I think what and once again, people in general forget about diabetes and sexual health is that your sexual health is like the canary just in the mine. That's often you'll hear the urologist, the gynecologist speak about that term. And I don't know if people are familiar with that, but that is sort of the thing that indicates to you from a medical point of view that your heart is not doing well, your arteries are not doing well. They are blocked up, they are damaged, they are inflamed. And the penis, to speak about it, as a peripheral organ, or organ at the end point of your body, like your toes, your fingers, things like that normally get affected in diabetics. That is actually the thing that is telling you it's getting poor blood supply. And if no blood goes in there, you're not going to be able to do what you want to do sexually, as a man. But yeah, I think we must remember that diabetes, doesn't just affect the physical body of a man. It affects, the psyche as well. It affects relationships as well, and all those things as a clinician you need to address when you are sitting down with a patient. And I think we need to be cognizant of that.
Yeah, it's a very it's a very nuanced and very layered kind of system, I suppose, and there are so many different aspects and layers to consider. I'm curious, doctor. Like, I understand from a medical perspective, like the issue with circulation, with like a bit of diabetic neuropathy and circulation issues, like you said, causing. That's why diabetics have issues with feet and toes and so on. And so I understand why the penis as one of the external organs, as you say, would have an issue with circulation. Is there, what's the reason behind like the effect on libido? As I mean, again, that's quite a layered question as well. But is there a reason? Is it like a testosterone thing? Is there some other kind of physiological effect happening that lowers not just that you struggle to get an erection because of blood flow, but libido and sex drive in itself? What is it about diabetes that affects that?
Look, if you want to look for or speak about a direct physical or physiological link between libido, low testosterone, and those type of things, then high or poor glycemic control. So when your glycemic control is poor, that has got a direct effect on reducing your testosterone. So yes, it is not just about it physically causing blockages in your microvasculature or your small blood vessels. High sugar levels inside of your body physiologically drops your testosterone. That is a well-known scientific fact. We know this for certain. But however, if you speak about libido itself doesn't just speak about physical attributes of a male being able to want to have sex. Often people look at libido and they think, oh, how much do I want sex? How much do I desire sex? That is what the public think of when they think about libido. But it's both physical in the sense of that it's a physiological phenomenon, but many times when you interview the couples, when you speak to the men who are unfortunately often not present, with the woman in consultations that we do as gynaes, you often find that the problem with libido is more partner-based, relationship-based, a man withdrawing from it, and basically, having had bad experiences sexually, and that is causing the problem in the libido. And physically, they're actually not that bad. Having said that as well, once target organ damage has occurred in diabetes, when I speak about target organ damage, it refers obviously to things like your eyes, your kidneys, and obviously, looking at, penile blood flow and in erectile dysfunction. Once bad target organ damage has occurred, it doesn't just affect the libido itself. It obviously affects all other organs inside the body as well. So we have to be very, once again, careful, just to attribute everything to physical symptoms. Yes, there is a physical link, but often, as I said, it's a relationship, it's bad experience, and it's psychological sometimes, that needs more addressing.
Yeah, absolutely. Again, there's lots of layers to it, and it will find a way of rearing its ugly head at different parts, of the process, I suppose. So I think we had a question live coming on YouTube from Randall McPherson, so about diabetes affecting testosterone. So that we just touched on that. So that's poor glycemic control and high blood sugars in particular, affecting the output, the production of testosterone, and how effectively it's used in the body. That'd be about right. So, cool. There you go, Randall. Hope that answers your question.
Thanks so much for that interesting insight, Doctor. And I think everyone would like to know how common is this occurrence, among men? Because we're going to touch on women as well, because surely diabetic women have also experienced issues with sex drive. And please, to the ladies in the comment section, please do feel free to share your experiences as well. But how common do these types of sexual health problems occur with men? And I think you answered the question on the best course of treatment, and it's just like, firstly, prevention is better than cure. It's best to control your glucose. But are there any other treatment options?
Look, so just to get to the first part of your question, is regarding how common these problems are. Obviously, in younger men, it's less common. So if you more or less about between the ages of 20 going on 24, if you look at the prevalence, it's more or less about like 6%. If you look, at how common, erectile dysfunction is amongst men. But once you age, and you're looking at men 55 years and older, that prevalence, can shoot up to like 50, going on 60%, or even higher. And I think you must also keep in mind that there is, how shall I put it? There is a normal aging of men, obviously. And even if you don't have diabetes, there will obviously be decreased testosterone, decreased libido, decreased sexual performance. So there is a normal physiological occurrence that obviously happens in that regard. But if you look at how would you, for example, the best course of treatment, except just treating the actual diabetes, and I say that in brushing over it, but getting good glycemic control is often harder, than what it looks for various reasons with the patient. Often the clinician, we are taught, as opposed to an old paternalistic system where the doctor decides everything, is more based treatment on joint decision making. And that joint decision making will actually decide what is the individual patient's risk, what the risk factors, what is acceptable modalities of treatment for that patient. And those modalities of treatment usually can start with, for example, things like, you want to try and sustain, first of all, try and get an erection, but then you also want to try and sustain it for a satisfactory period amount of time. Now, you can obviously understand that between men and different people, what the woman expects, what the man expects of himself, vary from person to person, that can vary from partner to partner. But the point is, when it comes to erectile dysfunction, it's getting an erection when you want it and to be able to sustain it for a period of time. And to that end, there are non-pharmacological things that obviously that you can do. And the most common things that people will know is that, for example, non-pharmacological is things like the vacuum pumps. There are urethral, devices that can be, obviously like inserted. But these things are obviously not always well tolerated, both because, it creates not a good mood or moment, etc., because you can't be spontaneous about it. Some of these things are very invasive, like the injections, for example. So they are not well tolerated as well. But these are non-invasive methods, that you can basically use. And those things, obviously, urologists and, obviously, can be consulted for that. But the first course of treatment, obviously, after getting good glycemic control, and would be what they call the PDE5, the phosphatidylesterases 5 inhibitors, that everybody knows, the Viagras, the Cialis, those type of things. Those are more the pharmacological types of treatments. And there are variants of them, obviously. that from a pharmacological point of view can be used and prescribed, once again, to the correct candidate. The candidate or the patient has to fit the correct profile, because obviously if your profile is not correct to take any of these medications or interventions, you are not going to be compliant with it. You're not going to get your effect, and then basically you have failed at the first hurdle. So I think a combined holistic approach and individualizing patients, that is what is important, with all these modalities that we basically have.
Okay, that brings us neatly onto, I think, a question that we had next, and that is, even assuming the patient fits the right profile for the anti-inhibitors, or something you called them, is there any additional risk as a person with diabetes? Is there any additional risk taking this course of action? Is there an additional risk for, say, a type 1 diabetic taking Viagra, for example, that's associated with that course of treatment?
Yeah. Look, as I said, diabetes, what you must remember, is causes target organ disease. Diabetes causes microvascular damage, so it damages organs, for example, like your heart, especially. Your heart is the pump that pumps blood out to the penis. The blood vessels that, obviously has to carry blood from the heart to the penis, and there are obviously very small blood vessels inside the penis as well. So it stands to reason that obviously a person who is a diabetic, that they themselves, must be cardiovascularly assessed for their cardiovascular risks. And those risks can be divided into, for example, if you go see a physician, you go see your gynae, you go see your urologist, that risk profile will be then divided into, are you a mild risk or are you a moderate to severe risk for cardiovascular event? And then you have to first get those risk factors under control before looking at, I want to get my penis to work, I want to be sexually able to perform, and there has to be some sort of satisfaction in that area. So although that we want to fulfill the patient's wishes as clinicians, we first have to do no harm to the patient that sits in front of us as holistically as possible. And that would entail that we can't prescribe, a Viagra or a Cialis to a patient, or say go and inject this or use this method, etc. But the patient uses it in, obviously, and is at risk of getting a heart attack, for example, because if your blood vessels, plaque is full of plaques, your heart pump as a pump is not working well. And you have things, for example, like, the heart muscle is weak, or there's this arrhythmia in your heart, for example, or some of the drugs, for example, get excreted via the kidneys, and your kidneys aren't working well. Medically, it won't be safe and ethical to prescribe a medication to give a patient sexual satisfaction, to put it that way, at the risk of their own life. At the end of the day, we first have to keep the patient alive and well and fix what can be fixed, and then look at things, for example, like, can we sexually get what they want, basically, to put it that way.
Fascinating, interesting. And we've had a great one of Shelley. Shelley loves the concept of, let me just bring the comment up, loves the concept of a combined holistic approach. Everyone is different, of course, so it makes sense that the diabetes is experienced slightly differently as well. So great to see doctors doing the good work and recognizing this, because this is just as a slight aside from this particular conversation. A lot of people that I've come across in the community that have shared experiences with me have always have unfortunately had a lot of horror stories to tell about the treatment they've received at the hands of an endocrinologist who was pretty stubborn or set in their own ways, or whatever kind of thing. And so recognizing that every diabetic experience is lived a little differently is really important step managing and controlling the condition, and especially so with a topic as personal and as personalized as this one. So good to know. Thank you, doctor.
Jacob, could I just add to that as well? I see there was a comment from Randall as well. There's some amazing comments and questions here, but I just about the combination of diet and exercise combined with medication. I think that's also so important. And you mentioned a combined holistic approach.
Yeah, Randall's
so
also
Randall, We trust your question was answered, though.
I think Randall specifically is looking for insights on HRT, on supplementing HRT. Would Dr. Christopher recommend supplementing HRT to make up for potential like low output, low personal, I guess, output of testosterone in the body if your sugars are not quite controlled?
If I can just answer that, because there's actually two parts to that question. The one issue is regarding low testosterone, and can obviously testosterone be given to a patient as hormone replacement therapy, and obviously then also what is the effect of medication, diet, exercise, obviously to improve diabetes and then hence hopefully improve sexual health. And those are linked matters, but they are two separate matters actually to look at as well. So when it comes to hormone replacement therapy and giving low dose of testosterone, part of your etiology, or actually the cause of why someone would have low testosterone, and low testosterone, as we know, has got a link to low libido and obviously maintaining sex drive and erection and those type of things. If one of the causes for low testosterone is genetically that there's something that they call hypogonadism, right? So that's either people can have the gonads are too small, they are underdeveloped, and then basically the gonads being the male testes, where your balls are. So that would basically be that those people could potentially benefit from testosterone if you give it in low doses, those candidates. If, however, you are looking at a couple coming for fertility treatment, you have to be very careful with that, because if you give testosterone to a male, right, that's got normal gonads, and giving them testosterone, there can be a negative feedback mechanism to the male's brain that feedbacks back to the testes and actually, makes testosterone underproduce and can cause subfertility in those men. So often you will have people, for example, guys, they look big and buff, and they're in the gym and they're using supplements, testosterone and things like that, etc. And now they're struggling to either maintain this erection, but they are subfertile and they can't have children. So once again, it comes back to what are you trying to achieve? Does this person still want to have children? Is he just trying to have sex, or is the gym more important to him, for example? So you have to look, why are people using it? And testosterone, I want to caution, is not you take testosterone supplements, you inject yourself with things, and often you will have guys also use things, for example, like opioids as well, that can also affect the testosterone levels as well. So one can't think that testosterone is a fix-all, but there is a place for it, low doses, but in, as I said, men that have got problems genetically, where the gonads, are not working well. If you look at the issue of diet and exercise as well, there's not any strong data to really show that diet and exercise per se would improve actually the testosterone levels per se, that would make you function sexually better. However, from a medical point of view, it obviously be better for your diabetes, right? And we have to once again come back to the point that diabetes is an very inflammatory condition. So if your diet obviously is very poor, takeaways and fatty foods and high in sugars and things like that, this causes a lot of inflammation in your blood vessels, and that can be damaging to you. And if that your blood vessels get damaged, and your HbA1c is high, it stands to reason that sexually you're not going to perform very well. So although there's not a direct link between how you sexually perform and what you eat, large studies to support that. And I know that online there are people that say, eat this and your testosterone will go up, and do this, and you will sexually perform, etc. Yes, these things potentially could, but what I'm trying to say scientifically, there's no robust evidence to hard and fast stand behind this and say that definitely does make a huge difference.
That is amazing. I mean, I can actually resonate with so many of the things that was said, and actually, some of my own issues that I've had, which is mainly fatigue, sometimes low sex drive. I mean, and that also doesn't help when you're dealing with a lot of life stress. You're dealing with stress at work, you're dealing with stress of studies as well. So, I mean, I can actually, safely say that I've experienced a lot of these issues. I mean, like in terms of addictions, that doesn't seem to be an issue, but definitely, like, before you even get to that point, it's like, I just don't feel like doing this. You have no drive. You just like watching TV and just like you don't feel like doing anything at that point. Especially like, if you can like start to recognize some of the events that have occurred in the week, Monday this happened, Tuesday this, by the time you get to Friday, everything's just piled up on you. I find that exercise does help me in that regard, in terms of getting that extra stress and frustration out of me. And obviously that coupled with good glycemic control, then I feel like I'm back to my normal self again. But I think we need to just, ask, we need to get to the other guys on the panel as well. So I think, for Brennan, as a single father and, going on various dates and meeting women, encountering spontaneous sex, how do you feel like diabetes, how do you feel that, like, how's that affected you? Do you sort of find yourself planning your sex more to make sure that you don't go low during sex, or that you're going to be able to perform? How's your confidence level on that?
That's an interesting question. Yeah, so from a libido perspective, I mean, let me just give a quick backstory on myself with regards to diabetes and libido. I was married for 7 years, and towards the end of my marriage, I started struggling with libido and maintaining erections. And I was like, what do I do? How do I sort this out? And I went to my diabetic doctor, and I said, this is the problem. How do I fix this? And he said, well, it's not typically a diabetic issue that occurs. I mean, it's not something that is caused by diabetes, is what he's mentioned. But he did prescribe me some Viagra, and it did help. From a dating perspective, and sugars and levels, I do find that occasionally during intercourse, if your blood sugars are not on the right level, I do struggle to perform. I'm not sure if that rings with anyone else, but so you always got to make sure that your levels are quite right. Otherwise, you have a bit of a, you got to like, oh shit, now what do I do? And you got to try and figure that stuff out. So I try and make sure my blood sugar is right, and I, from time to time, do use supplements to help me maintain an erection.
Yeah.
And that is, it's quite a big thing to do, because it's not something that you really want to be verbally talking to your partner with. It's like it's quite an intimate kind of discussion that you have, and especially since you're dating and they're new people and you're kind of getting in there, you want to make sure that things work. You don't want to have to get out there and go, well, now what?
Yeah, when it doesn't, perhaps some people, the dreaded question is always like, oh, is it me? And it's like, no, it's very much me, and whatever I've got going on inside, it's absolutely, I don't want to say fault, but it is very much not you. It is on this occasion, at least, it's whatever it's just not functioning correctly. It could be could be non-diabetes related, but like with me, for example, I didn't struggle with erectile dysfunction, and it's not a huge issue for me right now, but it has flared up or failed to flare up in the past.
Yeah.
But it wasn't an issue for me until I read, like, I was in the office. I was in like the consultant's office, or at the hospital, shall we say. And I saw, like, this is maybe my fourth or fifth appointment. So it was like maybe like a year, 2 years after diagnosis. And I'm in the doctor's office, and I see a poster on the wall which lists like, you know, one of these scare tactic style things with a laundry list of complications and problems that uncontrolled diabetes will cause, you know, the organ damage, the blindness, all the rest of it. And then for the first time I saw erectile dysfunction, and that just burrowed its way into my psyche. And I think the next time I was with somebody, like, it happened to me, and that was the first time I told, and that was like my girlfriend at university at the time. That I think was the first time I told her that I had diabetes. We hadn't been going out very long, but you know, it failed. You know, my erection failed to materialize in bed, and you know, the whole, oh, is it me? And I thought, actually, no, it's me, and I know why it's me, and I'll tell you why it's me, because apparently diabetes does this. By the way, I'm diabetic. You know, and that was the start of a whole thing. And so it's got better-ish since then. But to Dr. Christopher's earlier point about the psychological aspect of it, that's been a huge issue for me. Well, not massive, but like, I could definitely attest, I think, any of my problems more so to the psychological side, more so than perhaps the physical one, you know?
Most definitely. It's just so important to have a supportive partner as well who understands. And I think a lot of the ladies who are tuning in, you know, I'm sure that it's just sort of they're having a lot of aha moments now. Like, now I can understand, you know, why this happened or that happened with this diabetic guy. And look, I think, you know, Sali, who joined us last week for the first time, I think he can definitely speak to, you know, what it's been like for him. You know, just first and foremost, you know, the support or the lack of support that you have received, Sali. And don't forget to unmute. And then also, you know, just also maybe you could just shed some light as a diabetic amputee as well, how that's been for you over the past year and a half. You know, so I think first just the support, and then just how it's been.
Look, I mean, I can relate to Jacob, and I can relate to Brennan, you know, and yourself, you know. And I mean, I was diagnosed at the age of 17, and when I got married, I was 25, you know. And not looking after yourself, there was a lot of complications that actually arise, you know. And you know, on your first night of your wedding, you know, look, your wife knows that you're diabetic, but they don't know of your sexual performance, you know. So you're all excited and things, you know, you check if, you know, if your sugar levels are okay and everything. You actually can do this in the bathroom, you know. So to get to that point where, you know, everything is okay. And you know, the thing is, if you underperform, I mean, like, you know, Dr. What I was actually saying, there is certain things that you don't actually understand at that moment. What is actually causing it? You know, again, you know, like Brennan was saying, you know, is it, you know, me? The woman actually asked, you know, am I attractive enough, and all of these things, you know. Don't I turn you on? You know, so it's mentally exhausting, truly. You know, I mean, from the day one, and because, you know, the support over the years of being married to my first wife, she wasn't actually interested in actually finding out what is diabetes. You know. So this made things very hard for us to actually to gel. And because, if I must say that, okay, she was highly sexual, and every time I underperformed, and this actually caused a lot of friction, arguments and things, and you know, the diabetic arguments will lead to financial arguments, and I want to be here and I want to be there. So that also puts stress on you, you know, as a diabetic.
Yeah.
And so it was about 6 years down the line, and marriage ended up on the rocks,
because I mean
you know.
that never helped your sexual chemistry at all. In fact, it did the opposite.
That's right, you know.
Yeah.
And you know, second marriage, much better. You know, a person that actually understands diabetes. If you don't perform, you know, it is okay, don't stress yourself, that's the type of thing, we can try later, and so the support was actually much better,
Yeah, and that makes a world of difference. Just someone, just sorry to interrupt you, Sally, but just someone just saying, look, it's okay, it's cool. Let's just take a break. Let's chill. Let's watch an episode of something, and then you actually find yourself starting to relax within, because for sure, like when that is coming, and you sort of feel like a bit of panic within you, and now you sort of like try to overcompensate by doing a lot of different things, right?
That's it.
And then you just find like yourself just in a stressful situation. So it's just so important that your partner's like, hey, is everything okay? You know what I mean? And I think it's just so important that you just keep those channels of communication open, where look, it's okay for you to fail at your first attempt, and she must also, sort of understand that it's okay, and she must also have that confidence within herself to know that
There we go.
it's not her.
Yeah.
I think things just flow so much better. But what's it been like for you, Sally, like as an amputee?
I will say my amputation was actually a blessing, truly. I mean, my veins was shattered at the bottom. It was blood flow was poor. I had some issues with my erectile dysfunctions and things, and I went to a urologist. And they actually gave me some medication, and of course, Viagra. And I didn't like the performance of Viagra. I mean, it was something that my body just didn't feel well enough. But when it led to my amputation, it was something that after the first, you can say, month, I could feel there was something different in my body. And once when my leg was actually healed up and everything, if you see your wife and things, it's like there it is, Performance was better, everything, I went to the optometrist, and my eyesight has actually also improved with the exercises that I've been doing, my controls of my diabetes and amputation. The only thing I can say is it's a blessing, and performance is it's actually very, very, how can I say, good.
That's so inspiring and so reassuring, Sally, especially for other amputees who are watching this, both men and women. And I think, Jacob, we probably need to just check out some poll comments as well before we close. And it's not just for Dr. Christopher, please. Just this is sort of like the section of the webinar where it's anyone can comment. But it's not only for you alone, Dr. Christopher. I think the guys on the panel as well, they can also feel free if they need to sort of share their experiences. So what Jacob did was he went on Instagram during the week, and he asked, just what type of questions would the viewers like to sort of, ask, and what is it that they want to check out?
For sure. I think we've touched on a couple of them already. I think we touched on libido and so on, which has been great. But one question here, this might be an interesting one for any of you guys here with experience with this, Brennan, more recently in particular. And that is, we tend to judge ourselves quite a lot sometimes, especially when we're holding ourselves to, standards of performance, whether that's on a date, in the bedroom, or whatever. But good question I had on my Instagram was whether you felt judged by somebody else when you've, like Sally, for example, you said that your first wife didn't want to understand diabetes at all, right? So there may have been some level of judgment there from her side, in fact. And I'm wondering, Brennan, on the in your dating life recently, whether when you've divulged that you're diabetic, whether that's been met with any kind of negative judgment or reaction, or an Earl before you were married. I'm not sure if this is something you want to touch on either, but in your experience, like have you ever felt judged by somebody else due to misunderstanding or misconceptions or anything along those lines?
So from my perspective, I mean, I haven't really been judged as to that I'm diabetic, but I've had one of my partners was like, I don't really like that freestyle libero on your arm when we're having sex, or their judgment of your body in a way that you're wearing a patch. I've had that, which is weird. But that was one of the issues that I had. It's like, and I take that off. I'm like, no, what do you mean? This is part of what I do.
Absolutely
Okay.
not. Wow.
It was very weird, but not from a sexual side, not from that side, no.
Interesting, because I had a few some of the comments which came up because I put up a poll on my story saying, did you guys know that diabetes can affect sexual health? And there was a good balance actually of yes and no, and a few people messaged me to share their experiences. They were quite curious as to how it did affect it, and I said many ways. There can be libido, ED, vaginal dryness in women, but also what a couple of other people had said to me was that they felt very, very self-conscious about their tech, about their pump or their patch, their CGM or something. Which again, so it's not a physiological thing, but the fact that you are wearing your diabetes, on your person, if you like, can make it quite awkward for some people. Especially, I mean, I don't wear a pump myself. I don't think any of us are pump users, but with tubing and cannulas and the thing everywhere, could be a bit of an awkward proposal there too. So certainly the whole wearable tech thing's a big one. Oh, Sally, what about you guys?
Well, mine is short and sweet. I mean, my wife was then my girlfriend when I was diagnosed.
Oh, nice.
So that channel of communication has always been open. So I never felt judged at all. Surely there was, times of frustration, I guess. But the more you communicate about these things, just the better they become. And then you go into a little bit of a dip, and then things are good. And occasional dip now and then, but I've never felt judged. And I think like the more we even talk about it now, I think it'll make it okay for the rest of the viewers as well. To just open those channels of communication. Like, look, this is an actual issue. Like someone has high blood pressure, or someone has this condition or that condition. I have diabetes, and it affects my sexual health. It is what it is. Sally?
Which brings us on to Sally. I think as you're answering this question, we can consider this one as well, because this brings us on nicely to the next question. Good one from Dallas. Thank you again for tuning in, for joining us from last week also. And she's asking what partners or future partners can do to help us feel safe when talking about it, when communicating with it. Earlier, you've touched, of course, on the open channels of communication and confidence in oneself as a partner, to know that it's not always, your fault, dare I say, if you're facing erectile dysfunction or whatever it might be. So how do we think people can be a better support with this kind of thing?
From my side, if they take an interest, the partners, okay, be it men or be it the females, it is something that which helped me in my second marriage, and it is something that actually took me forward in a way that she's more understanding. She's more relatable. So if I have an issue, again, if somebody understands your condition and you can't perform, then it's less judgmental. Okay, I mean, with my amputation, I found that do I look attractive enough? With standing in front of your wife and she's looking at the amputation. There again, your mental health also gets affected. So with your mental health being affected, you can't get in the erection. So if I can relate to this question here, the effects and of the help or the support of your partner or even your family, it is essential for your performance in all round, be it sexual, be it your mental health, be it whatever in diabetes. And the support should be there. Really, it should be there, And if they can actually, if you are newly dating or anything, it is something that find out what is diabetes, what is the complications, the mood swings, everything can be related to your relationship and your performance with each other.
Good, nice one.
Dr. Christopher, you had a question.
Yes. So as I mentioned to you guys earlier, we obviously interview couples. So I would like to propose from the other side of the line as well, that often what I hear the women say is that not necessarily to diabetic men, but when it comes to erectile dysfunction and this what we're speaking about performance in the bedroom, is that my husband or my partner thinks that the only thing that needs to perform is basically his ability to get an erection and to basically get it in there and to basically
Stay there.
think that is what is the performance. And I think we need to, I know that this is a panel on sexual health specifically related to diabetes, but I think also as men, we need to open ourselves up to the possibility and to think that we speak about partner and partner support and how they see you and all of that. And that is very important, yes. And open communication, very important. But however, that we must also remember as men that, it is not just about, how quickly and how hard and how long, obviously the penis can stand up. That I always try to explain to the men in practice when they do have problems like that and say that you must sort of see that more as the finishing act, and that is not the only act, that is basically happening from a sexual health point of view. And like I said earlier, you can't form as a 20-year-old when you are 40 years old. I mean, I'm turning 40 next year, and I certainly, and I'm not even diagnosed as diabetes, and I know I'm not, performing as a, as a 20-year-old anymore. And we have to be cognizant of that fact. But I think as men, we need to open ourselves up to know that women don't just expect you to suddenly, I don't just have the erection, get it in there, do that the whole time. I think there's also some misconception there, and there are other ways to sort of like perform to satisfy the woman, because I think as men, you think that is sort of like the goal. This is sort of what they want. And I think sometimes in society, we are obviously conditioned like that. And I think we need to open the discussion to things like that, and I know we're focusing on diabetes, but to think that if we are only going to focus on the penis needs to perform, the penis needs blood flow, and it needs to do its job, I think we're missing a big part of what it is as a man to satisfy a woman. And I think we need to be cognizant of that. I think we'll be missing a big part of it.
Yeah. No, that's amazing. I mean, we're so focused on the physical, we've got such animal instinct within us that, we forget to tap into the emotional side of things. Jacob, you had some more comments or some more questions over there before we close?
Yeah, we've touched on a couple. Let me see. So we've touched on libido, being judged on a date. Good one. Good one. How has the approach to talking about T1D evolved with relationships and sex? Like, from my perspective, I know it certainly helped me to be more open about my condition. Without, the first few years after my diagnosis, I was a closed book. Like I said, it took me a while to even divulge to my first girlfriend post-diagnosis that I was diabetic. I used to carry it very, very close to my chest because I was still working through a few things, and having been diagnosed and dealing with the, I was embarrassed about my condition, really. Now, over the years, as that's evolved and I've matured, I'd like to think, I suppose my approach to talking about it has just been to be more open and be more upfront and let people know, because people aren't going to know how to support you otherwise. People aren't going to know what kind of help you might need or what you're going through and why you're going through it, what the reasons for certain things might be. And that's how you start to address misconceptions or incorrect assumptions about what this condition really entails. So for me, it's about, certainly I feel that in the relationships I've had since diagnosis, I've been much more open. I've been getting increasingly open and upfront, forthcoming about the knock-on effects of diabetes and so on. So I'd say that's been my learning curve, if you like.
No, that's true. And you actually reminded me of a question that someone asked in our first webinar as well. Like, how does he tell his new girlfriend? I can't remember the gentleman's name. How does he tell his new girlfriend that he's diabetic? And when you just tell. But then again, that's just me, because things come easily to me, but it might not be that easy for the next person. And a lot of people struggle to disclose their condition. Whereas for me, I have the sort of rip the band-aid off approach, where I'm just like, hey man, I'm diabetic. I think like in my job interview as well, with my current job, when I was in the job interview, I just told everyone, hey, look, I'm diabetic, but it doesn't affect my work performance. I mean, at times it might, but then I'll just catch up later.
Yeah.
I think we should probably just get to the final comments right now, Jacob, just in the interest of time.
Yeah, sure. I think that brings. I think we can wrap it up nicely then on that note with a good question from Greg. That is, what makes it easier or challenging to discuss these topics with the people around us? I mean, you mentioned open channels of communication, being forthright, ripping the band-aid off, and so on. But these are deeply personal topics. These are, I used to be embarrassed to go to a doctor's office and say penis, so it is like there are hurdles for people to overcome in some respect. Like we can't all be as brash and as open and vulnerable as we need to be all the time. So I don't know, in your experience, guys, like what makes it easier for you to discuss these topics, do you think?
From my
perspective,
yeah, I think during a lot of the dates that I used to go on, I used to struggle to open up and say, listen, I'm diabetic, and it would only come closer to, getting close to intercourse, and I go, listen, I just let you know that I'm diabetic, and then there's like these questions, and then it's like, okay, let's carry on with it. But it's, I mean, I used to also as well keep it quite close to I didn't really talk like you, like ripping a band-aid off. Earl, I used to just like, keep it in and until I needed to, and then I'd tell them then, and it wasn't really something that bothered me. But I think as I've grown and got more used to it, I think being open about it and telling people up front really does help. And you can raise issues that could occur during intercourse that you want to say, listen, this could be an issue, and it could this, so just understand. But that's not very easy to do when you're meeting new people and you're trying to make these things happen. So it's quite an interesting dynamic to deal with as a diabetic.
Yeah, for sure, agreed.
Yeah, no, that's great. And then just for Dr. Christopher, in your practice as well, do you find that, when speaking to diabetics, do you feel that they are aware enough of the effects on their sexual health? Or do you find that a lot of them still shy away even though they are speaking to a medical professional?
I think the topic of any sexual health issue is sort of avoided in practice with somebody that you don't know, even medical professionals as well. But I think it's often up to the medical professional as well. It is a duty on both sides, yes. But it's also, you will find that in a large proportion, if you look in the research and the studies, did your doctor ask you about sexual health issues, men or women, you will find that very little times that it's not asked, that topic is not brought up. And if you are not aware of these things as a medical professional, and you don't ask the question, you're not going to get the answer. So often when something is uncomfortable or there's a stigma attached to it, and I mean, I must be honest, sitting here listening as well to you guys speaking about it, it's like, am I going to disclose I'm diabetic? Am I not going to disclose I'm diabetic? It's sort of as if the diabetes is automatically linked to, this is a guy that is not going to sexually perform. This is a guy that won't be able to satisfy me, sort of like thing. And I think that is not necessarily true. And I think patients sort of expect that and get that also ingrained within themselves and accept the embarrassment and the stigma that is created around it. I think often we are our own worst enemies as well. And all I can say from a medical point of view, yes, doctors do need to be aware and ask the patient more, but also a patient needs to realize that it is a safe environment. It's a confidential environment. There is not a judgment from a doctor. You are not in a relationship with them. You do not have to perform for them at all. So rather get the help that you need. That's what I would encourage people to do.
Yeah, wow. Thanks so much. And Sally, just any final comment from your side before Jacob closes? I feel like we just scratched the surface actually tonight, I feel like we definitely need to have a follow-up, a part 2 sometime in the new year. But just Sally, any final thoughts from your side before Jacob's Jacob takes us
Look, I
home.
mean, going through my early days, with the dating and things, it was actually very awkward for me, and being in my age now, even with like if I do the peer support, with other diabetics and trying to actually get them to open up. You have to actually find a strategy on how to actually help them, and a lot of times, a lot of them would actually rip the plastic, and just ball out, and so yeah, there is a lot of approaches that can work for men to, or anybody to actually open up, So with my peer support, I mean, I've been getting a lot of good feedback on topics like this, to take them into another direction. So yeah, that's
Amazing. Thanks so much, Jacob.
Brilliant. No, well, that wraps us up very nicely on the hour mark. We don't want to take out too much more of people's Sundays. So if you're still with us, thank you very much for sticking around to the end of the episode. And of course, thank you to all of you gentlemen for joining us, especially Dr. Christopher giving us an hour of his expert medical opinion. Always much appreciated. Thank you very much for that. And Brennan and Sally, thank you guys for being so open and candid with us. Like, it's these kinds of vulnerable conversations that are so important to drive more awareness and understanding. I think Dallas would like a part 2 for sure. I think so. It'd be good to know that she'd be tuning in. Thank you, Dallas. Great chat. Thank you, everyone. No, thank you very much again to all of you and any of you at home for tuning in, whether you're watching this live or you're catching up. We hope it's been interesting. We hope it's been informative. We hope you've learned something and have gained a greater understanding and hopefully a new perspective on this condition, and whether you are dealing with it as a man living with diabetes, or as the partner of a man living with diabetes, or as a woman living with diabetes, or whoever you might be watching this. We hope that it's offered you an interesting and useful perspective on how to approach this condition and its various nuances and aspects. So yeah, thank you guys again, really, for being part of this. Hope you guys had fun. I certainly did. I've certainly learned a lot. And we'll look forward maybe doing this again sometime. For sure, because I think, like you said, we've barely just scratched the surface. So again, thank you all, everyone, for tuning in. We'll be doing our third and final episode. Well, I'm not going to say final because I think there's a lot more we can do. But the final episode of the series will be next Sunday. And that is going to be talking about. Oh, remind me what we're going to be talking about.
Yeah, so kind of figured we'll just be talking about diabetes and the male ego.
Mm-hmm.
Diabetes and the male ego, and just sort of being with the guys, you not taking care of yourself properly because you don't want to test yourself. The guys are going to think I'm weak. You're out on a date. You don't really want to check yourself or eat the proper snacks because you want to be in. Your ego is sort of like a barrier to taking better care of yourself.
Exactly
care of yourself.
Exactly that. And male ego follows quite nicely from a conversation such as this. So we'll probably be touching on a couple of topics again next week related to this. But yeah, anyway, next week will be all about diabetes and male ego. But for now, wherever you are in the world, from Cape Town or the UK or wherever you might be, thank you very, very much. Go and enjoy the rest of your Sunday, and we'll be back online next week. Thank you very much.
Good, guys.
Thanks, everyone.
cheers.